The swing bed program is a program offered specifically for critical access hospitals for small communities with limited resources to get people back to home quickly. I'm Amy Barger. I'm the inpatient nursing manager and swing bed coordinator at Putnam County Hospital. I've been here in some capacity for 7 years as a nurse, and I've been a nurse roughly 15 years. I was born and raised in Putnam County, and I came back to raise my family here.
My name is Hannah Nugent. I've been here for 5 years at Putnam County Hospital. I work in both the emergency department and the 4th floor inpatient unit.
My name is Hannah Klein. I'm the dietary manager and registered dietitian here for Putnam County Hospital. I've been here almost 9 years in June.
My name is Kim Stanley. I've been a case manager here at the hospital since 2020. I have been a registered nurse for the past 12 years and have been in case management for the past 8 years.
I am Jaideep Samant. I'm a physical therapist. I've worked here for 4 years, and I also am the team leader of the therapy department. I manage outpatient and inpatient physical therapy needs.
My name is Bethany Combs. I'm the VP of Clinical Operations here at Putnam County Hospital for a little over a year. I am a local, a graduate of South Putnam High School, and a registered nurse. My background is mainly in emergency medicine, where I've also served other local communities surrounding Putnam County Hospital.
A lot of times when you're done at the hospital, it's time to discharge, but you're not quite ready to go home. There's some space in between. A lot of people are not wanting to go to long-term care facilities or skilled facilities for that rehab. So swing bed is offered in hospital as a transition point to get them home safely.
The swing bed program, we can offer them the physical therapy that they need, speech therapy, occupational therapy. We have a registered dietitian, and we also do IV antibiotics and wound care. So all of that will help them get better and healthy and be able to go home.
My role with the swing bed program basically is to make sure that all of our patients are well fed, nutritious meals, that kind of thing, and just a well-rounded variety of foods that they get to choose from.
Typically, I work with outpatients for a variety of issues such as low back pain, knee replacements, hip replacements, and I also perform wound care services. So we often see people that come in with injuries or other issues such as lymphedema or swollen legs.
A patient after an acute stay, a surgery, or an illness is seeking rehabilitation.
In practice, what it'll look like is I'll work with a patient a few times a day, and we will use a therapy gym, which will allow the patient to work on their specific issues, such as being able to get on and off a step, or being able to get in and out of a car, or being able to walk without a walker. And we try to keep it very intensive so we can get as much therapy done in a relatively shorter period of time, and we're able to get these patients home.
The swing bed patients work very closely with physical therapy. Physical therapy or occupational therapy will be in and out of the room multiple times throughout the day. In a swing bed program, you're able to wear regular street clothes instead of a hospital gown. You're able to go outside with a nurse or a nurse assistant for a supervised visit, and they have a lot more independence in the room, moving around the room by themselves without a nurse being in there all the time.
Home health sometimes takes a short time to get set up, or the family needs time to put ramps in or adjust the home to the new needs of the family. So the swing bed program not only offers the therapies and the care in the hospital, but gives the families and the patients some time to get home health set up and get the needs for the patients in their home.
All of our patients that come in, every nutritional requirement that they have going on, whatever they may need, is covered. So a lot of times that can vary a lot based on patient to patient, but also doesn't stop just here. So whenever they're discharged, I can follow them whenever they get home to make sure that all of their needs are met. So it doesn't just end whenever they leave PCH. I'm able to follow them and make sure that, they have a meal plan for when they go home, and just make sure that all of those bases are covered so they don't feel like that is a missing piece for their return home.
I see the patients walk in the door and they are weak, they're not able to take care of themselves at home. They get admitted to the 4th floor and work with us, physical therapy, occupational therapy, and throughout a 1 to 2 week time span, they get stronger and stronger. So the most rewarding part is being able to see them go home with their family instead of having to go to a skilled nursing facility. Oftentimes the patients are a lot happier getting to go home.
This year we have had 9 patients admit to the swing bed program. We've transitioned 8 of those home. 1 needed a little bit more additional therapy before we could get them home. So we have a very high success rate for our patients.
If you're in a hospital here, our care team kicks in from the get-go. From the day one, we start talking about what your options for home are. You start discharge on admission. So we start talking about where you're gonna go, what your needs are, what your wants are. We have a wonderful success rate. Really, thanks to our team does a really deep dive into all patients.
As a swing bed patient, you can also leave the hospital to go to doctor's appointments. So if you got your knee or hip replaced somewhere else and need to follow up with your orthopedic surgeon, a family member can provide you transportation and you can leave for half a day to go to your doctor's appointment.
The importance of the swing bed program is to make sure that you receive all the care that you need in an environment that you feel safe and comfortable in.
About a year ago, I had a patient who was transferred here from a different hospital. They had their knee replaced at the other facility. I think they were here for 2 weeks. They transferred here because it was much closer to their home, so their husband would come visit them, other family members would come visit them, and it was a 10-minute time frame instead of 30-minute drive for them to visit the patient, and they would bring the patient dinner and hang out with them for an hour or so every evening.
So if you or your loved one are in need of a program that brings about compassionate and comprehensive care together, the swing bed program is the right option for you.